Hello, my name is Dr. Drew Moffitt, and I'm the Medical Director of Arizona Reproductive Medicine Specialists, and this is another edition of our Facebook Live series. The topic today is minimal or mini IVF versus gentle IVF. I've been having a lot of patients lately who have had questions about doing mini IVF and how might that be different than gentle IVF. So we're going to talk a little bit about that today. First of all, again, my name is Dr. Drew Moffitt, and I'm the Medical Director of Arizona Reproductive Medicine Specialists in Phoenix. You can find us online at arizonafertility.com, or you can reach us directly at 602-343-2767. That's 602-343-2767. On our website, we have something called Talk to a Doc Today, and if you just click on that, you can ask a question, and I will give you a call back that evening and go over what your question is. Also, if you just want to contact us, there is all over the website that's something that says Contact Us, and we can answer a question just online if you have a question for us. Anyway, to the topic, mini IVF versus gentle IVF. So mini IVF is something that's been out there for quite some time. It comes and goes. And basically the idea is taking a smaller amount of medicine for the main purpose of reducing the cost of an IVF cycle. And this is an idea that has been around for a very long time. For you history buffs, actually, in vitro fertilization started in a natural cycle where the person was not given any medication at all, and that didn't work so good. The person only produced one egg, and it was relatively inefficient. The very first IVF baby was conceived through that method, but it was quickly realized that they needed to get more eggs. So the next thing they tried was clomiphene citrate, and that did okay. They got about 2 to 3 eggs, but it still wasn't very efficient. And then at a place called Norfolk, the Jones Institute for Reproductive Medicine, their group, who was the first group to have an IVF baby in the United States, they quickly switched to using gonadotropins, which is a follicle stimulating hormone preparation that you have to take by injection. And they realized that by giving that, they were able to get a lot more eggs, and the efficiency of the process was increased significantly. And that's kind of where IVF took off from there, this idea of giving straight injectables, which was great because you got lots of eggs, but it was relatively expensive because the medications were expensive. And so periodically there has been this attempt to turn back and go back to a simpler IVF protocol where you would be able to lower the cost. And frequently they experience the same thing, meaning you get fewer eggs, and so your success rates have not been as good. Now, a recent article that was published, this was in 2016, it was a kind of a review article of all of the published minimal stimulation protocols at that time. And kind of the goal of all of them, as they discuss in the article, is to make 5 or 6 eggs. And that's kind of the goal of those protocols, and they do that pretty well. In 2017, in November, so just under a year ago, there was a large Cochrane review. A Cochrane review is where this organization reviews the published literature and then comes out with information or comments about it. And in this Cochrane review on minimal stimulation protocols, they comment that the pregnancy rate that you can expect to get in the published studies, the live birth rates, were around 15 to 30%. So the question really is getting 5 eggs and getting a pregnancy rate of 30 to 50% good enough? And or can we do better? So what we ought to do is kind of go back and just talk about, how many eggs do you need to get in order to get a baby? And so I don't know if this is going to work very well, but I put together a little slide that I wanted to try and show on here. So let me hold that up and we'll see if that even works out. I'll hold that up just for a second. And you can freeze that and go back and look at that. But anyway, we're going to be talking about that. So what the slide does, it says, okay, let's start with a baby. And that's what we want a live baby. So in order to have a live baby, ultimately we want to figure out, just from a theoretical experiment, how many eggs do we need to get to have a really high chance of having a baby. So if you have, in order to have one baby, you need to have a chromosomally normal embryo, an embryo that doesn't have any problems with the chromosomes. And so studies have shown that when you put back a chromosomally normal embryo, the best success rates you're getting are between 55 and 65%. There are programs that are getting better than 65%, but let's just use 65%. What that's telling us is that if you have just one chromosomally normal embryo, you don't have a really, super high chance of getting that one baby. You need to have two. If you have two chromosomally normal embryos, then the chance that you're going to be able to get a pregnancy out of that becomes higher. So we want to have two chromosomally normal embryos. Well, in order to have two chromosomally normal embryos, how many total embryos do you need to have? Well, the statistics show that a 30 to 35-year-old woman has about 50% of the eggs she makes are chromosomally normal. So in order to have two chromosomally normal embryos, you're going to need to have 4 total embryos, or what we call blastocysts. So the next question is, well, what do you need to get those 4 blastocysts? Well, that question ultimately is, how many fertilized eggs do you need in order to get 4 blastocysts? And so blast formation rates, meaning the percent of blastocysts that are formed from a fertilized egg, is about 50%. So you need about 8 fertilized eggs in order to get those 4 blastocysts. Well, does every egg fertilize? No, every egg does not fertilize. Fertilization rates vary between 70 and 80%. So let's say they're great and they're 80%. You're going to need to have 10 eggs in order to get those 8 fertilized eggs. So ultimately, a reasonable ballpark goal of how many eggs you need to get a high probability of that baby is you're going to need to have 10 eggs. And we know that minimal stimulation protocols just don't really deliver 10 eggs reliably. There will be some patients that get that number, but it's not the majority of patients are not getting in at 10 eggs. So in trying to figure out how to make this work for my patients, that's how I put together the Gentle IVF protocol, which is essentially a combination of pills and shots at a level and in a progression that gives a high probability of getting those 10 eggs. And basically that's the reason why, so that we can have a high probability of getting them to 10 eggs. It involves taking a combination of clomiphene and a modest amount of gentle follicle stimulating hormone injections, and also some other medications that prevent premature release of those eggs. And that's what we call our Gentle IVF cycle. And I recently went back and looked at how many total eggs on average we're getting from that protocol. And interestingly, in women who have a kind of a normal ovarian function, meaning they have an anti-Mullerian hormone level greater than 2.5, that hormone is a hormone which kind of gives us an idea of how many eggs are in your basket. And when we have a level greater than 2.5, on average, we would get 20 eggs from these patients. So it's a simple protocol, but a very effective protocol in getting a bunch of eggs. Anyway, that's the difference between a minimal stimulation or a mini IVF and Gentle IVF. And I'd love to talk to you more about it. Again, you can go to ArizonaFertility.com. That's ArizonaFertility.com. And you can ask a question through our Contact Us section, or you can go to the Talk to a Doctor today and ask to have the doctor talk to you that day. Or you can just call directly our number, which is 602-343-2767. That's 602-343-2767. And they can figure out a way for us to connect. Anyway, I hope that that has been helpful as you try to decide how to make this work. Now, obviously, the big advantage of all of these protocols, including a Gentle IVF protocol, is the cost of that. And our website is very transparent as far as the costs. But the medication costs can be as low as $1,500 for the medications, and compared to normal IVF cycles, which will have medication costs in the $3,000 to $5,000 range. Anyway, hope that's been helpful, and have a great evening. Bye-bye.